Let me ask you a simple but powerful question. Can your skin reveal that you might have diabetes, even before a blood test does? The answer is yes. And that's exactly what we're going to uncover today. Most people think diabetes only affects blood sugar, but in reality, it silently impacts almost every part of the body, including your skin. In fact, doctors say that in some people, the first visible warning signs of diabetes actually appear on the skin, long before you're diagnosed. Some of these changes are subtle and easily ignored, while others are more noticeable and alarming. So today, let's go deeper and explore the early and late skin changes that can indicate diabetes and what they're really telling your body. Number 1. The dark velvety patches, Acanthosis Nigricans. Have you ever noticed a dark, thick, velvety patch of skin on the back of your neck, under your arms, or around your groin? Many people assume it's just dirt or pigmentation, but this could be an early clue your body is becoming resistant to insulin. This condition is known as Acanthosis Nigricans, and it's one of the earliest visible signs of prediabetes. It usually appears in people who are overweight, but can also develop in those with genetic insulin resistance. These dark bands are caused by excess insulin-stimulating skin cells to grow faster. If you or someone you know has noticed this change, especially along with fatigue or weight gain, it's time to talk to your doctor and check blood glucose levels. Catching it early can prevent full-blown diabetes and its complications. Number 2. Clusters of skin tags. Tiny growths that speak volumes. Skin tags are small, soft pieces of skin that hang off the surface. Many people have 1 or 2. That's normal. But if you suddenly develop multiple skin tags, especially around your neck, eyelids, armpits, or groin, it could be your skin's way of signaling insulin resistance. Studies show that people with multiple skin tags are at a higher risk of developing type 2 diabetes. So if you notice several appearing along with darkened skin, don't ignore it. It might be your body's early cry for help. Number 3, shiny, hard patches on the skin. Necrobiosis lipoitica. This one looks quite different. It starts as small, red or yellow bumps that gradually turn into shiny, thin patches, often on the shins. As the condition progresses, you might see visible blood vessels beneath the surface, and the area can become itchy, painful, or tender. This is known as necrobiosis lipoitica, a skin disorder more common in women with diabetes. Interestingly, it goes through cycles. Sometimes active, then quiet for a while, then flares up again. If you ever see these kinds of patches, it's essential to test for diabetes early, as this condition often develops in those with poor blood sugar control. Number 4, tight, thickened skin on fingers. Digital sclerosis. Now imagine your fingers starting to feel stiff, the skin turning tight and waxy, almost like it's hard to bend your joints. This is called digital sclerosis, and it affects around 1/3 of people with type 1 diabetes. Sometimes it spreads to your toes, forehead, or even knees. In advanced cases, it can make simple movements difficult. Controlling blood sugar and doing regular hand exercises can help, while moisturizing the skin keeps it supple. Ignoring it can lead to permanent stiffness over time. Number 5, brown, round spots on the shins. Diabetic dermopathy. These are often mistaken for age spots, but they're actually called diabetic dermopathy. They look like small, round, brown, or reddish spots, commonly found on the shins, sometimes on arms or thighs. They're harmless and don't cause pain or itching, but they're a signal of changes in blood vessels and circulation due to diabetes. While these spots may fade after 18-24 months, they can also remain indefinitely. Seeing them, especially with other risk factors, is another reason to get screened for diabetes. Number 6, painless blisters that look like burns, diabetic bullae. Now this is rare but striking when it happens. Some people with uncontrolled diabetes suddenly develop large, fluid-filled blisters on their hands, feet, or legs, resembling burn blisters. The strange part? They don't hurt. These blisters, called diabetic bullae, occur due to nerve and vessel damage from long-term high blood sugar. They usually heal on their own, but they're a warning that diabetes control needs urgent attention. Number 7, yellow, itchy bumps. Eruptive xanthomatosis. Ever noticed small yellowish-red bumps that look like pimples but don't go away? These often appear on the buttocks, thighs, elbows, or knees, and they tend to be tender and very itchy. This condition, eruptive xanthomatosis, happens when triglyceride and glucose levels shoot up due to poorly controlled diabetes. The good news? When blood sugar and cholesterol are brought under control, these bumps disappear completely. Number 8. Skin infections. When sugar feeds bacteria and fungi, high blood sugar weakens your immune system, making your skin more prone to infections. People with diabetes often face recurrent bacterial infections like styes, eye gland infections, folliculitis, hair follicle infections, carbuncles, deep, painful boils under the skin. Fungal infections are also common, especially in warm, moist areas, under the breasts, around the groin, between toes and fingers, or even in the corners of the mouth. Candida, the most common fungus, causes red, itchy rashes with white patches. Conditions like athlete's foot, ringworm, and vaginal yeast infections are also frequent in diabetics. Number 9. Poor healing and diabetic ulcers. One of the most serious skin complications in diabetes is poor wound healing. Because of nerve damage and poor circulation, even a small cut can take weeks or months to heal, especially on the feet. These open wounds, called diabetic ulcers, can become infected and lead to serious complications. That's why diabetic patients should check their feet daily and consult a doctor if they notice any wound, blister, or sore that doesn't heal quickly. Number 10. Localized itching and dryness. Constant itching on your lower legs or arms could also be linked to diabetes. It can result from dry skin, yeast infection, or reduced blood flow. To manage this, avoid long hot showers, use gentle soaps, and apply moisturizing cream after every bath. If you notice one or more of these changes, don't panic, but don't ignore them either. While having one sign doesn't necessarily mean you have diabetes. If you also have risk factors like obesity, family history, or a sedentary lifestyle, it's crucial to get tested. Remember, early detection is your best defense. Managing your blood sugar today can prevent complications tomorrow, not just for your skin, but for your eyes, kidneys, nerves, and heart. So pay attention to what your skin is trying to tell you. It's often the body's earliest messenger. Thank you for watching. If you found this video helpful, make sure to like, share, and subscribe. Your one share could help someone recognize early signs of diabetes and get life-saving treatment on time.